Hello, my name is Jaden Martinez, and today I'll be sharing my presentation for this case study project. My presentation is entitled Diabetes Insipidus and Lung Adenocarcinoma, as these are the two diseases or conditions involved in my chosen case study. The case I am reporting on today is entitled Diabetes Insipidus as a Presentation of Lung Adenocarcinoma. It was published in the Journal of Medical Case Reports on August 13th, 2025. I chose this case as it appeared to be a complicated case and was also dealing with cancer and how cancer can cause unexpected health conditions in a patient. As we'll see in this case, the diabetes insipidus, or DI, was a result of lung cancer causes changing in the patient's body, resulting in DI. I just thought this was highly interesting and a highly intriguing case that depicts how doctors and healthcare providers diagnose and treat complex health conditions. So, beginning with the clinical manifestations, or the health status of the patient as they appeared at the hospital, and what was observed about their health condition. Our patient was a 50-year-old Iranian male whose main complaint was of polyuria and polydipsia, or excessive urination and excessive thirst, respectively. His vitals were stable upon arrival, and the doctors initially diagnosed the man with central diabetes insipidus, which is a type of diabetes insipidus. However, upon further evaluation, this led to a discovery that the patient had lost a significant amount of weight in the past few months, that the patient originally attributed to a new diet. However, the doctors then performed CT scans and MRI scans of the patient's lungs and brain and discovered lesions in the brain and cancerous nodules in his lungs. However, there were no signs of pituitary or cellular abnormalities in the brain, which relates to the known symptoms of these diseases. So DI is a rare paraneoplastic manifestation. Paraneoplastic syndromes are manifestations that are conditions that arise secondary to the presence of a tumor, or a disorder that can occur alongside a tumor as a result of a tumor releasing substances that cause the body to behave abnormally. So polyuria and polydipsia, as well as nocturia, which is nighttime urination, are the main known symptoms of diabetes insipidus. Patients can also experience dehydration, vomiting, irritation, and fever as a result of DI. Further, what's fascinating about this case is that the metastasis of the pituitary gland or hypothalamus are a common cause of CDI in patients with cancer, meaning that people with cancer that is spread to the pituitary gland or the hypothalamus may also experience symptoms of CDI or DI as a result of the cancer. However, our patient did not have any damage to the pituitary gland, making it surprising and difficult to assume that he had an unknown cancer or metastatic growth. Also, I thought it was important to note the known lung cancer symptoms, like the presence of a tumor in the bronchial glands, cough, weight loss, and shortness of breath. Our patient only had one of these symptoms at initial examination, the weight loss. So again, it was unexpected, or at least the doctors had to do a lot of medical investigating in order to uncover his lung cancer. Also, most cases of lung adenocarcinoma occur in patients over 50 years old. And also, this cancer is present with paraneoplastic syndromes. So knowing that he had diabetes insipidus, which although rare, is a paraneoplastic manifestation, it could have been reasoned that he had a cancer, which is, as we see, is how these physicians were able to find the tumor. Okay, so what were the diagnostic methods used in this case? Upon hearing the patient's symptoms of polyuria and polydipsia, the doctors ordered several blood and other bodily fluid tests, like a urine-specific gravity test and a serum sodium levels test, which are accurate tests to determine if a patient has diabetes insipidus. They also conducted a complete blood count to further investigate the patient's overall health. So on the bottom right, the picture on the bottom right is a list of all the laboratory tests conducted on the patient. In my eyes, showing how detailed and determined the physicians were in collecting health data on the patient to understand his health condition. All right, so upon receiving the lab tests, the doctors performed CT scans and a brain MRI to get a clear picture of what was going on inside the patient. The brain MRI revealed lesions in the rectus gyrus and the occipital lobe. The CT scan of the chest revealed multiple nodules on the right upper lobe, which you can see in the picture in the upper right hand side of this slide. The scan shows the nodules in picture B that confirm the presence of a lung tumor. The doctor sought to further confirm a diagnosis of lung adenocarcinoma by performing a transbronchial lung biopsy, which revealed atypical epithelial cells with large nuclei consistent with a diagnosis of lung adenocarcinoma. This biopsy is an accurate way to inspect the tissues and formations inside the bronchi of the lungs, as well as extract biological material which then could be analyzed by the doctors treating this patient. So finally, using all the knowledge gained from the laboratory tests and medical imaging, the physicians diagnosed the patient with central diabetes insipidus as a result of lung adenocarcinoma. The medical tests and imaging helped diagnose the patient and led to a treatment plan to help address his multiple health issues. First, before the doctors discovered the lung tumor, they administered intranasal desmopressin, which is a medication to help treat diabetes insipidus and help patients control their urine production. Once the cancer was found, he was treated with systemic chemotherapy in a plan consisting of 2 cycles of platinum-based chemotherapy on day 1 and day 8 after they discovered the tumor. Platinum chemotherapy is a common form of chemotherapy used to treat all kinds of cancers, including lung cancer. Unfortunately, our patient's condition deteriorated rather rapidly, and they passed away a day after the second round of chemotherapy. On the right is a picture of the timeline events documenting important information about the patient and the day those events occurred. So you can see when they began administering the desmopressin to treat the diabetes insipidus, when they performed the CT scan and the MRI, and when they started chemotherapy, and the day at which he passed away. Although the patient passed away, below is further prognosis for conditions that the patient had. So with the patient with their DI, their condition can be treated, and they will receive a short-term administration of desmopressin to avoid dehydration. The short-term prognosis for a patient with lung cancer is that they will begin chemotherapy and must receive a chest CT scan every 6 to 12 months to keep track of their lung cancer. In the long term, or the long-term prognosis, a patient with DI will have no long-term complications if they are properly treated. Unfortunately, the long-term prognosis for lung cancer patients is not as positive. The 5-year survival rate for metastasis non-small cell lung cancer is around 12%. And this is the type of cancer that our patient had, meaning that 12% of patients with this condition would survive to the 5-year mark of being diagnosed with this condition. In comparison, the 5-year survival rate for all type non-small cell lung cancer is around 32%, which is a better outcome, but of course not the most positive statistical number in regards to the survival ability of lung cancer. In conclusion, I thought it would be important to include 2 quotes from the case report that emphasize the greater significance of this case. This being that clinicians should maintain a high index of suspicion for paraneoplastic syndromes when encountering a sudden onset of rare clinical conditions. which would lead to a thorough investigations, including neuroimaging and functional hypothesis, which are essential for early diagnosis of underlying malignancies and timely initiation of appropriate therapy. In my opinion, and of course I'm just a student and not even a medical student, I thought the physicians as doctors did the best that they could in trying to diagnose the patient, and as soon as they had an idea of what was happening with the patient, they ordered the appropriate tests and lab tests to confirm their hypotheses, as well as administering the appropriate treatment when they knew that the specific treatment was required for that specific condition. Unfortunately, the patient didn't respond to the chemotherapy and quickly succumbed to their illness. Of course, it would have been better if he received the treatment earlier, but again, he didn't show the normal symptoms of this rare disease like diabetes insipidus as a presentation of lung adenocarcinoma, which would have led the doctors to continue to investigate the health conditions of the patient, like investigating the presence of a tumor or cancerous cells. Which is why I think these quotes are significant, because it is important for clinicians to remember that characteristics of paraneoplastic syndromes and their relation to conditions like diabetes insipidus and various cancers are important to investigate when you're looking at a patient like the one in this case report. Here are my references for the information included in this presentation. And lastly, thank you for listening to my presentation, and I hope you have a great day.